From ABC, this is World News Tonight with Peter Jennings.
Good evening. The national debate over health care has been joined at the highest levels. President Bush has outlined his plan for health care reform. The president said today he doesn't think Americans want to be shoveled into some new health care bureaucracy. Therefore, he recommends that the government provide vouchers, tax credits, and deductions, so Americans, especially the poorest, can buy into the private health care system that already exists. We begin our reporting on this subject with our White House correspondent, Britt Hugh.
After years of deliberation and delay, the president finally unveiled his plan to deal with what he acknowledged today is a crisis. He said health care in America is the best in the world, but it costs too much and too many people, some 35 million, can't afford it.
And my plan will preserve what works and reform what doesn't. And above all, it will ensure every American universal access to affordable health insurance.
The Bush plan's greatest help would go to uninsured families of 3 or more with income at or below the poverty line of roughly $14,000 a year. They would get a tax credit or government cash voucher worth $3,750 a year to apply to the cost of private health insurance. The administration estimates that 25 million families, not all, but most of those now without insurance, would qualify for this maximum benefit. Families with higher incomes would receive progressively, indeed substantially less. For families with incomes of $22,000 a year, for example, the government voucher would be only $375. Those with $80,000 a year income would receive no government assistance. To make sure that the maximum benefit of $3,750 would buy basic insurance, private companies would be required to develop basic health policies at that price. The government would also help small businesses band together to create groups, so-called health insurance networks, large enough to qualify for reduced group insurance premiums. The plan would cost the federal government $35 billion a year by the time it's fully in effect. The administration did not specify how it would be paid for exactly, except by providing a 38-page list of proposed health care reforms it said would save at least that amount. This plan may not give Americans all the medical coverage they need, but it might just give this president the political coverage he needs. Until this day, on this issue, he was the man with no plan. Britt Hugh, ABC News, the White House.
Mr. Bush was in Cleveland today because an example of the kind of insurance plan he favors is already in place there. Tonight, our medical correspondent George Strait takes a closer look at the Cleveland plan to see who participates and who is included.
Mally's Chocolate Factory has lowered its health care cost and insured more employees by joining other small businesses in Cleveland to get group rates. But there are still problems. Insurance coverage and low rates are not guaranteed for all workers.
Some programs that our organization offers are not available to everyone.
An employee with a serious illness may not get full coverage. A business with a number of medically risky employees may be denied coverage or pay higher rates. Still, the president favors creating a number of small business groups around the country called health insurance networks. But many health economists say that will create a new bureaucracy that could raise, not lower, health care costs.
Small businesses banding together would try to do what big businesses have tried to do in negotiating lower rates of payment with hospitals and doctors. Big businesses haven't been able to do it. Small businesses won't do any better.
The administration also wants to lower costs through the increased use of health maintenance organizations. HMOs and other strictly managed health care plans have operated for more than 10 years. How much they really save is now being seriously questioned.
The costs for managed care, even the most effective managed care, our long-standing health maintenance organizations, rise at the same rate that all costs rise in the nation.
The president's plan would prevent insurance companies from refusing to cover people who already are sick and want to change jobs. But the plan would not stop companies from raising the rates so high as to make insurance unaffordable, and there's little in it that strictly controls the rising cost of health care. George Strait, ABC News, New York.
Just one more note on the subject today, or at least for now. Today, the Centers for Disease Control said while the U.S. recorded its lowest infant mortality rate ever in 1989, virtually every industrialized nation in the world does better. On the American agenda tonight, we'll actually have more on the health care crisis. And in other news tonight, a military plane crashes into a restaurant in Indiana. 16 people are dead. And finally this evening, Queen Elizabeth celebrates 40 years as Britain's monarch.